This is EHJ Today at the scientific sessions of the American Heart Association in Chicago 2014. I'm Tom Lüscher, Editor-in-Chief of the European Heart Journal, and I'm talking to Stephanie Schübke from Munich and Gilles Montalesco from Paris. Welcome.
Thank you.
So Stephanie, you presented the ISAR-SAFE trial at the session here. Tell us a bit about the background. What made you analyze these data and design the trial?
So ISAR-SAFE was designed because the optimal duration of clopidogrel treatment as part of dual antiplatelet therapy after drug-eluting stent implantation is still not known. So we know very well that patients with stent implantation require dual antiplatelet therapy. We don't know for how long. And this is also mirrored in differing guidelines on both sides of the Atlantic. So while in the European guidelines it is stressed that in stable patients there's no reason to extend 6 months, in the American guidelines it is emphasized that patients at low risk of bleeding should receive at least 12 months of dual antiplatelet therapy. So recently several randomized trials have analyzed the issue of dual antiplatelet therapy. Well, ISAR-SAFE is double-blind, and it compares 6 versus 12 months of clopidogrel therapy. It tests the hypothesis that 6 months of clopidogrel therapy is non-inferior to 12 months in terms of net clinical outcomes.
And what patients did you consider?
So we enrolled patients not at the time of PCI, but at 6 months after PCI, at the time that treatment arms started to differ. Patients that were on clopidogrel therapy, and this is important to point out, so we did not include patients with bleeding within that time period after stenting, also no patient that had a myocardial infarction in that time. Which might have created a selection bias, of course, but on the other hand, the time of randomization we think was absolutely correct, because if we had included patients at the time of randomization, we would have had a dilution of events, because at that time both treatment arms actually received the same therapy.
So it's sort of close to clinical practice, like the treating physician decides at 6 months whether to continue or not. And were these all stable patients? Tell us a little bit about the patients.
Yeah, so in terms of baseline characteristics, it's important to point out that 40% of the patients presented with an acute coronary syndrome at the time of index PCI. So a quarter had diabetes, 26% incurred a primary cardiac infarction. It's also notable that only 11% of the patients received a first generation, either paclitaxel or sirolimus-eluting stent. So ISAR-SAFE can be considered as a trial of predominantly new generation drug-eluting stents.
But of course this was left to the investigator,
absolutely
to the
left
operators.
at the discretion of the operator,
Yes.
right? Yeah.
And then they were randomized and it was all blinded, and what was the follow-up period?
Yeah, so the primary endpoint was assessed at 9 months after randomization. So 3 months after the treatment was over. And the reason for this was we were afraid of a potential clustering of events after therapy discontinuation. So if this clustering occurred, there would have been an imbalance favoring the 12 months group.
Right. So yes, and what did you find?
So the main finding of the ISAR-SAFE trial was that there was no significant difference in net clinical outcome in patients assigned to either 6 or 12 months of clopidogrel therapy.
And remind us again on the primary endpoint was?
It was a net clinical outcome endpoint combining death, myocardial infarction, stent thrombosis, stroke, and TIMI major bleeding.
Okay. And what was the safety endpoint?
Actually, there was no specifically safety endpoint. We had secondary endpoints, which were the individual components of the primary endpoint. And overall event rates were very low and comparable between both groups. And then we looked at additional endpoints like TIMI minor bleeding, and we also assessed more recent criteria of bleeding like BARC. And then we found a numerical but non-significant increase in TIMI minor bleeding and a significant increase with 12 months therapy in BARC bleeding.
In those who received 12 months,
yes,
compared to only 6 months, yeah. So Gilles, what do you think about this trial?
It's an important trial that you have conducted, because for this question of 6 months versus 12 months, So having a shorter duration of dual antiplatelet therapy as recommended by the European guidelines. We have only small studies, and this one is a larger study in the field. So congratulations, it is very useful, we need it. The second point is that these studies, all of them, are very difficult to conduct. We can see that the sample size is always too small. This study was also interrupted prematurely because recruitment was difficult. On their own, each study is unable to conclude, definitely, because what we want to see, of course, is better safety by shortening the treatment, preserving the protection against stent thrombosis and MI. And individually, these studies cannot conclude. But when you pull all these studies together, and this one is the largest, you have the answer to the question. Yes, a shorter treatment is safer, and we can reduce major bleeding with the pooled analyzers. And yes, you have the protection that you expect with 6 months therapy, no excess of MI, no excess of stent thrombosis, no excess of death. So I think we have answered the question, and this study is going to support the current recommendation of the guidelines.
Yeah, that was a very courageous step forward in the guidelines, absolutely. So a meta-analysis would be the next step, do you think? What do you think?
That's what I presented discussing this paper, having all the studies together, 5, and the 2 new ones, pulling the data together. That was a strong signal to say we reduce major bleeding. None of these studies individually could show that. MI was hopefully the same with short versus 12 months. In the middle of this meta-analysis, we have to understand that we have studies that have mixed 2 different questions, 6 months, sometimes 3 months, versus 24 months, for example, of therapy, which is not recommended. And of course, you see some larger magnitude of the effect with this comparison, especially for major bleeding. For example, Prodigy is one of these studies where you see a signal on major bleeding, but the comparison is not exactly the same.
Do you think that the new drugs that are more commonly used in many countries, for instance, Switzerland, we use mainly ticagrelor and prasugrel, it will be the same?
These drugs are supposed to be used in ACS patients, and the guidelines say treatment is for a year. Yeah. So for these patients, it's difficult to extrapolate 6 months from your study to ACS patients. However, you had ACS patients, yes. Other studies had ACS patients. When you look at the subgroups, it seems to work also. Yeah. So we have to rethink this 1-year period of treatment also in ACS patients, even if we are looking at subgroups now, and it's kind of shaky ground to conclude.
Yeah, the Volvimili study had also ACS patients, and you had 40%, you said, yes. And all comes from the cure data that are quite old data, and so we have to reconsider this as well. So what is going to be the next step? Are you planning another trial, or was it that difficult to recruit that you think that the meta-analysis will solve the issue?
I think meta-analysis are now very important. So if we recalculated the sample size with the actually observed event rates, and if we wanted to have a trial that is powered for this question, we would have to include more than 40,000 patients, and I don't think this trial will ever be done.
Yeah, that shows that we got so good in treating our patients that it's difficult to perform the trials, yes.
Although event rates were low and it made us so difficult to conduct the trial, it's on the other hand a very good news for the patients, because treatment has become so safe.
Right, and it's also good news for the ESC and the guidelines where you were involved, that in fact 6 months may be effective and safe.
Yes, because the committee was challenged by the North American colleagues, saying, yes, the data are not that strong to support 6 months therapy, but this additional study goes along this line. Yeah.
Okay, thank you very much. Yeah, Sabine, thank you.